This video is going to cover some history and research related to the BSN, mostly because for part of our history, we'll talk about in 1965, a push started to say that the BSN should be the entry into practice. That has not occurred, but there have some things that have been happening. So this video discusses that history and research and where we're at. So the history of the BSN, it starts with looking at where it started. And in the early 20th century, people started thinking, we have these training programs, but nurses are professionals, and they shouldn't just be like learning on the job. There should be an educational pathway for them. This is pretty serious work. And in 1909, at the University of Minnesota, a BSN program was opened, which provided an alternative to hospital-based diploma programs, which were there was not an associate degree yet. There was just that occurred after the wars. In 1909, they started a BSN program. In 1923, the Goldmark report said that nursing education should move into universities rather than hospital-based training programs. And in 1948, the Brown Report, which was commissioned by the Carnegie Foundation, said that that nursing education should be in a collegiate setting because it was a professional discipline. In 1965, the landmark ANA position paper regarding the BSN was published. And this is when I entered nursing school in 1981, and we heard this. This was something that was taught to us. I entered in a BSN program, and the ANA said that the BSN should be the minimum educational requirement for professional nursing practice. And associate degree nursing programs and diploma programs should prepare technical nurses that would work under BSN prepared RNs. There was strong opposition from those diploma and ADN programs, which were providing most of the nurses at that time, as well as some hospitals which relied on less educated nurses for staffing. They didn't want that to occur. They were worried that it would raise the costs of employees. In the 70s through 90s, there was resistance and some state-level proposals formed. Despite the stance, most states and institutions resisted mandatory BSN requirements because there were workforce shortage, the cost and accessibility of BSN programs for nursing students to go to, and the popularity of community college ADN programs, which provided a quicker and more affordable route to becoming an RN. Some states considered requiring BSNs, but no state enacted a law mandating one. In 2000 to present, there's growing support for BSN as entry level. The IOM report said that 80% of nurses hold a BSN by 2020. In 2017, BSN in 10 was formed. Magnet recognition said that hospitals, and that's a big credentialing program that talks about the best hospitals, and they now require BSN prepared nurses. Current trends. Although there is this support for the BSN as entry level, we know that associate degree nurses are very, if they come from a strong program, are very well prepared. And I think the only hospital in Cincinnati that was requiring a BSN to hire was Children's, unless you were employed at Children's in another capacity before that. However, with the nursing shortage, that has gone under the bridge. But RN to BSN bridge program has become widespread to help ADN and diploma nurses transition. The ADN pathway remains prominent, particularly in rural and underserved areas and in urban areas where people can't afford to pay the cost of going to a university. Research related to the superiority of the BSN never differentiates between those whose first degree was a BSN and those attending RN to BSN programs. So I think that the mark was moved. Instead of having entry into practice be a BSN, the move was to encourage nurses who did not have their BSN to gain their BSN, to earn a BSN. And in many situations, it is felt that those nurses that are in RN to BSN programs, sometimes there's some superiority. And that should be good for you. I went to a BSN program, so not for me, but for you, there is some thought that they are superior in that they got trained quickly, started working, had some work knowledge under their belt, practical application, so had real world nursing knowledge, and then they finished the BSN. So there has been research. Aiken et al., it's published in JAMA, the Journal of the American Medical Association, and the Lancet, found that hospitals with a higher proportion of BSN-prepared nurses have lower patient mortality rates and better patient outcomes. A 10% increase in BSN-prepared nurses in a hospital was associated with a 5% decrease in patient mortality. BSN-prepared nurses were better at critical thinking, clinical decision-making, and identifying complications early. Implication, this research has been widely cited in efforts to increase BSN education. Once again, I would argue that BSN education does not equal entry into practice being a BSN. The IOM report in 2010, Institute of Medicine, The Future of Nursing, Leading Change, Advancing Health, recommended increasing the percentage of BSN nurses to 80% by 2020. And I couldn't find, I forgot to look beforehand. I will maybe put it in the announcements where we're at which percentage of nurses, as we are past 2020, is our BSN prepared. We know that BSN nurses demonstrate stronger leadership, etc., but BSN does not equal BSN as entry into practice. I think if you had a BSN nurse who graduated from a BSN program 1 year out and an associate degree nurse who had experience, of course the associate degree nurse with experience is probably going to be the better and safer practitioner. The BSN just puts the icing on the cake for associate degree nurses and makes them better prepared for leadership, evidence-based practice, etc. Now, so the IOM caused hospitals and policymakers to push for BSN-prepared nursing staff. The BSN in 10 law in New York was passed in 2017. In other states, and it is encouraged to try to increase the BSN population. And a lot of hospitals on hire will say, we'll hire you, but you have 5 years or whatever to get your BSN. But the hospital also usually has tuition reimbursement to help you get that. The Agency for Healthcare Research and Quality Study in 2014 found that hospitals with higher BSN staffing levels had fewer medication errors, lower infection rates, and better patient satisfaction. And nurses with the BSN showed a greater proficiency and quality improvement in evidence-based practice. And the Health Affairs Study in 2019 looked at the impact of BSN education on hospital readmissions. It found that BSN-prepared nurses were linked to lower readmission rates. And the factor they found was that there was better patient education and discharge planning. The Magnet Recognition Program, you don't have to have all BSNs to be part of Magnet, but you have to show that you're trying to increase the number of BSN prepared nurses on your units. And studies have shown that magnet hospitals have better patient outcomes, higher job satisfaction, and lower mortality rates. Counterarguments and limitations in research. Some studies suggest that years of experience might be just as important as your education level, and that really makes sense. An experienced seasoned nurse is going to be able to function at a higher level. There are disparities, the cost and accessibility of BSN program, especially in rural areas, although there are more and more online programs because of this. And then some researchers argue that ADN nurses from strong educational programs can perform at similar levels in bedside care. Whoops! And I did not delete this slide. So this is the slide from my other slide presentation. Please ignore it. And my conclusion here, I'm sorry about that. I thought I got all those out, is that the research strongly supports the idea that BSN prepared nurses provide safer, higher quality, evidence-based care. Although policies are increasingly favoring BSN, education accessibility remains a challenge, and hospitals and policymakers continue to push for higher BSN enrollment while also supporting ADN to BSN bridge programs like this. Thank you for listening, and sorry about the error on slide 14, and have a great week.